Good morning again from Northwest Arkansas. It's a warm 68 degrees out here today on the 3rd of December in 2021. Can't believe how warm it is, but it most certainly is beautiful. Okay, today's video is not so much for you, the head and neck cancer patient, as much as it is for those who are caring for you or your friends and family who just want to do something. You know, they say, hey, what can I do for you? What can I get for you? And you know, first off, you're probably shy about saying those kind of things. And second off, you may not really know what is going to be useful for you as you go through treatment. And by the time you're going through it, it's almost too late. So this video is something you can share with them or others and let them know how they can help you go through treatment better. Let's start off with my favorite device, way back here. It's this fellow. This cost about 20 bucks at Walgreens. My wife got it. It is not something for smoking, no. This is actually a cool mist humidifier. We use this a lot. I kept this on all the time. And this particular one had a little blue light in it, so it glowed at nighttime for me, which is really nice. But we kept the cool mist going all the time, and I'm sure there was some benefit to my nasal passages and otherwise my throat and everything from having that so close. I had to sleep up on the couch in the living room because it kind of reclines, and head and neck cancer patients have to sleep up during treatment and everything. And this was really handy because it was out in the living room with me. And again, it was only about 20 bucks. The next thing that's not really too expensive but useful is my doctor told me not to use a regular razor to shave because he said the actual regular razor will actually peel off part of my skin, and since it was being irritated already, he said that was a bad idea. Get an electric razor. And I did. I went out and got this electric razor. It's a Norelco, or yeah, Philips Norelco. I don't work for them. I don't support Norelco. It's just that's what I got. It cost me about, I think, 30 bucks at Walmart. In fact, I even had it shipped to me. It came next day or something. So they're not very expensive, very useful. I did use it for shaving when I started having to shave. After a while of radiation, I didn't have to shave on one side. I only had to shave one of the other side because the radiation took care of the hair over there. But that's something your friends and family can get you as well. It's really handy. One of my favorite things, really easy to get, ubiquitous in stores, are cotton swabs. I used cotton swabs all the time. I mean, literally hundreds of them during my process. When I had my nasal tube, I used these for moistening my nasal passages. I also used them for clearing obstructions, without getting graphic, that I needed to clear, that I couldn't clear in any ordinary fashion. After that, I used these for moistening my nose during the when I was going through treatment, when I was getting all dry. I also use these to dip into my magic mouthwash. Now, some people get the magic mouthwash and they have to gargle and swallow it in order to eat. I had a tube, so I didn't worry about eating, so that wasn't my purpose for the magic mouthwash, which is really just a lidocaine solution and some other stuff put together. I use this when I got little sores in my mouth. I would dab my Q-tip or my cotton swab in that and just rub it on the sore. And since it was deadened with pain or from pain, I didn't mess with it, so it went away overnight. So any sores I got, they were just gone the next day because I was able to use these and stick magic mouthwash on them. Another handy little device, early on, especially if you're well into treatment, this may not be so useful. But this is a 3-in-1. It's a pill cutter, it's a pill crusher, and thirdly, it's a pill storage device. When I was going through my initial treatment and I had the nasal tube, everything had to go through that nasal tube. And the nasal tube is a really skinny little tube. So my pain medication, which was basically Tylenol, had to get crushed up, put in water, and then sucked up, we'll get to that, and then put in through my nasal tube. So the pill crusher storage container cutter is a really handy little device to get, especially for the caretaker. The patient may not be using this quite so much, but the caretaker, absolutely. Which brings me to the next item, syringes. Most people do not just have syringes sitting around the house. This one's a 2-ouncer or 60 cc's. This little fella here is a 5 milliliter one. Both of these are very handy, especially with the nasal tube. I had to use this to feed myself. I would put this in my Ensure, suck up 2 ounces of Ensure at a time, put that through the tube real slowly, because that's all you could do, until it finally got empty, and then fill it up again. It took 4 or 5 fills to get one Ensure down, which is part of the reason I hated that freaking nasal tube. But anyways, I went and got syringes. If you're interested, ask me, and I'll put the link down below. I don't work for the company, I don't support the company, I just Googled a company to find. That's the company I ordered them from. I think I got like 30 of them. They were very fairly priced as far as I was concerned. So I'm happy to do that. Otherwise, just go search for your own. The little one was very handy for me for two purposes. One of my friends, Sarah and Jared, had made chicken broth for me, which turned out being just a godsend after the TOR surgery over here, because my throat was really hurting. I couldn't eat for about 5 or 6 days. And the first thing I was able to put down my throat was warm chicken broth. And I'd pull up 4 or 5 milliliters and put 2 milliliters in my mouth and just swallow it. And that was great. I got to tell you, that was fantastic tasting. Just to have it taste again and to have that warm, greasy liquid go down over top of those cauterized wounds was fantastic. But I needed these little syringes to do that. Later, when I was taking that liquid morphine, although the prescription called for 5 to 7 milliliters at a time, I only wanted to take 2 or 3, so I was able to pull up 2 or 3 milliliters in here and squirt that under my tongue and let it do its thing. It tasted horrible. No one's ever going to get addicted to liquid morphine. I'm telling you, that stuff tastes horrible, but it does the job, which will bring me to another video in the future because it also constipates you. We're going to have a video about that whole topic here in a little while. Speaking of constipation, wouldn't hurt if somebody were to get you some Dulcolax or Miralax or whatever favorite laxative you have. If you don't have a favorite laxative, doesn't matter. Pick one. I found that I needed these a lot, especially after about my 3rd chemo treatment, and for about 3 or 4 weeks. Now, I may make a video in the future. I didn't take these as needed. There was a lot of complications in my case because of this. And by the way, I don't dispense any medical advice. Make sure these things are okay with your doctors before you take anything, aspirins or whatever. So please don't take what I'm saying as medical advice. Your cancer patient friend may appreciate these, and they may be a little embarrassing to ask for them. Hey, another great item, antibacterial soap. Before I got my G-tube placed, the doctor wanted me to use 3 days of antibacterial soap around where the incision was going to go. And subsequently, I had to wash that every day. I mean, I had to take the little bandage off, wash around it, and I would wash all around the area too, using this antibacterial soap. I think I only used like 2 bars for my whole time, because I only used it here. I didn't wash my whole body with the antibacterial. I did that with the rest of it. But again, cheap. I just used Dial. It seemed to work. I didn't get any infections, so it was fine with me. On that note, let's talk about bandages, especially if you get a G-tube. A doctor gave us these. These are Telfa, T-L-F-A. I don't think that's a brand. I think that's no, it is trademarked. Okay, adhesive dressing, which I call bandage. This one's 2 inches by 3 inches. He gave me 100 of these. These little things, we tore it open. After every shower, I had to replace the bandage on my G-tube, and we cut down the middle of this, so it would be, we'd open it up, and we'd slide that up under the tube, and then it would adhere to my skin. And because the G-tube, at least in my case, had a lot of seepage, especially if I ate or drank anything, which is another reason why I didn't eat or drink many things. Another reason I didn't eat or drink many things. This was very handy for that period of time. So if somebody can get you some of those, I think you'll appreciate that as well. If nothing else, it saves you from having to go out and get them. And on the note of bandages, you may have seen my video about taping your mouth shut. This is just a roll. I don't even know what size this is. This is, no, it doesn't say on the inside. It's just regular old, I guess, surgical tape of some sorts, medical tape of some sorts. I think I bought 4 or 5 rolls off Google or Amazon or something for a couple bucks. It wasn't too awful much. I think I used about 3 rolls of this stuff. Between tape my mouth shut, I had to tape my G-tube to my skin. Some people use elastic bands and stuff like that. I tape mine constantly, and after 3 or 4 showers, of course, it would wear off, so I'd have to retape it. I found this tape to be very, very, very handy. It doesn't hurt to come off the skin, and it holds mouth shut pretty well, and it holds G-tubes pretty well. So another good thing, I think. Lozenges of various sorts. I used Cepacol. I like the Cepacol a lot. They were good for my moisture. There was a period of time when I just really needed a lozenge all the time. Now, some people like these citrusy ones. They claim that the citrus flavor excites their taste buds or makes something work in their taste buds, and that's fine. You may find that to be the case as well. I'd recommend non-sugar ones. I use some Cepacol, I use these, I tried a couple different cough drops. You know, with drops and lost stuff, sometimes after a day or so you kind of get tired of that particular flavor or the impact of that. So have a couple of these around. So this is something your friends and family can get you really cheap and plentiful, and they're ubiquitous. You can get them everywhere. Which leads me then, before I get to my final three things, I want to talk just a minute about, now we've been talking mainly radiation stuff here, I want to talk about chemo. If you're going into chemo, or presently in chemo, and your friends and family want to get you something, my recommendation is, for inexpensive things, a couple easy puzzle books. For me, I took a real easy crossword puzzle book. I didn't want to sit in chemo and have to be thinking. It wasn't a mental exercise for me. It was a stay busy exercise. And so I had my sisters-in-law, actually. I have several sisters-in-law. And they got together and got me a care package, and there was a bunch of little puzzle books in there, some word find books, things like that. I found those really handy. A nice little backpack just for chemo would be great for your head and neck cancer patient. They can put in there some plastic spoons and forks, they can put in their puzzle books, a couple pens, USB chargers for their devices, because you're in that chair for 4 to 6 hours. My chair had 2 USB plug-ins. I was able to charge my devices while I was there. It would be a real shame to be sitting there using your devices, taking up that time while you're sitting there with the needles in your arm, and have your phone or tablet or whatever run out. So charging cords, maybe even a little charger. I bought one for 20 bucks. It's a great little charger. It's got 2 ports on it. It charges fast. It charges devices fast. It's nice and portable, not very heavy. Great things for people going to chemotherapy like that. And the backpack, if you really want to have fun, get the backpack and fill it full of that stuff. You know, and just give that to them as a whole. They can take out the things they're going to not use, put in a few things they may want to use, and they can take that to chemo with them. And having everything in one pack makes going to chemo much easier, because after the 3rd or 4th time and after radiation starts getting to your body, we get really tired, and carrying stuff is not easy. I remember just dragging myself into radiation chemo those last few weeks, so keep that in mind, okay? Another great thing to get people going to chemo. Finally, and this is thanks to Pip Lilly on CSN. I read her answer for keeping skin soft and supple during and after radiation for her husband, and it worked. So I decided to try it, just like she did it. Okay, so this recipe is Pip Lilly. So if you get on CSN and you find Pip Lilly, you can thank her for this, especially when your skin comes out soft and supple like mine has after radiation. I had radiation in the morning, 8:30, so I was up by 9. First thing, she said, aloe gel, pure aloe gel, no alcohol. And you'll see, I only used this much of it in 7 weeks of treatment. But squirt a little bit on my hand, rub that into the area that just got radiated. I should have gone here on my scar right here, didn't think about it, don't know why. I only did the radiation part, and I didn't get radiated here. This would be probably invisible now if I had. First thing, aloe. You don't gotta gob it on, just get aloe in there, get some moisture in there. Midday, she recommended pure coconut oil. Again, no alcohol, nothing in here but coconut oil. We'd squirt some of this. When I say we, I mean my wife, Pat. She did all this. I didn't even have the energy to take care of this stuff. I mean, I did the aloe in the car because she was driving me home. But when it came to everything else, Pat did it. Bless her heart, I had a great caretaker. But anyways, this is Palmer's coconut oil. Again, I'm not associated with Palmer's. And just I rubbed this in, or she rubbed this into that area and left that be. You've probably already heard of Aquifer. We bought 4 or 5 jars of this. In 7 weeks, that's all we used. Okay? And we used it every day. The Aquifer we did at nighttime, just before I went to sleep. We take that and we put a lot of that on. Now that we went everywhere on the Aquifer. And we used a t-shirt and tied a t-shirt around my neck and used a chip clip to hold it in place. It didn't hold really well, but it did keep the Aquifer from getting on the couch and pillows and stuff like that. That was all I was concerned about. So those 3 things together worked out really well for taking care of my skin, and I'd highly recommend those 3 things together. And before I go, I think I have one more thing. Yes, it was just basic. This is acetaminophen. Again, not unless your doctor says so. And the same thing with Benadryl, only if your doctor says so. I found great benefits from the Benadryl. If he told me to take it as something to help me sleep, because chemo, the steroids in the chemo was keeping me awake at night for the 2 or 3 days after chemo. He said, take some Benadryl. And, oh, here it is. Benadryl. This was, I don't even know, 100 tablets of 25 milligrams, and I'd take a Benadryl. And it did help put me to sleep. Side benefit, as you go through your head and neck cancer treatment, you've probably already read about this mucosis, this thickening of the saliva in the back of your throat and the mucus back there, which causes no pain, but a whole bunch of little issues. It's just no fun. It's gross, it's no fun. I didn't realize it, but I started using Benadryl to help me sleep during radiation because I just wanted to sleep it off. I swear to God, I wanted to get home from radiation, go to sleep, wake up the next day and do it again. But you just can't sleep 23 hours a day. Your body won't let you, or your mind won't let you do that. So I started taking Benadryl to try to help get me a nap in the afternoon. I found out that I wasn't having as much mucosis after I was taking the Benadryl. So for me, it was not only a sleep aid, but it helped mitigate some of my mucosis. And again, by all means, do not ingest any kind of OTC or prescription medicine without the okay of your primary doctor or your oncologist. They know all the other stuff going into you. They know all the side effects of everything. Do not take anything without their recommendations. Ask them to be sure. Hey, can I take Benadryl? If they say yes, knock it out. Ask your friends and family to buy you some Benadryl. I went through a lot of Benadryls. So, well, there you go. There's a whole list of things that your friends and family can look at to try to get for you to make your experience a little bit easier. And when they're asking you, what can I get for you? Now you got some answers. You can say a cool mist humidifier, some pure coconut oil, some Aquifer, those things. And anything that's extra, don't open any more things than you have to, because when it's all over, you can donate those things back to your oncology center. We took those extra jars of Aquifer and gave them to Hope Cancer Resources, who were stationed right there at our oncology center, and they were very helpful to us. We may do a video on Hope Cancer Resources someday. There's a great little organization. So, hey, enjoy your day wherever you are in your treatment, and however difficult it's becoming for you. We all know that. We've all been there. Please like, share, comment on this video if you will. Comments mean a lot because we can interact, and if you have some ideas of things people should get, by all means put it down there. If I'm wrong about something, by all means put it down there. Let us know. Let other people know. Things that have worked for you or your friends and family, put it down there. This video is for everybody, okay? Everybody who wants to is going through this or wants to help somebody going through this. So remember to never ever give up. Have a good day as Christmas rolls around. I hope you have a great Christmas, and let's hope this weather cools down soon, okay? Have a good one, guys.